Hello and welcome to Medical Dialogues. I'm Anchika Mishra. Let's look at today's top medical news. Meta-analysis confirms COVID-19 vaccination in pregnancy protects both mother and baby safely. An analysis of data from over 1.2 million pregnant individuals found that those who received a COVID-19 vaccination had a 58% lower risk of being infected with the virus, as well as a lower risk of experiencing a stillbirth or preterm birth, according to research presented during the American Academy of Pediatrics 2025 National Conference and Exhibition at the Colorado Convention Center from September 26 to 30. For the study, the author conducted a systematic search where she included 23 meta-analyses inclusive of over 200 studies and 1,250,000 pregnant individuals with documented COVID-19 vaccination. She found that COVID-19 vaccination during pregnancy offers significant protection to newborn and mother, said Nikan Zargarzadeh, study author and Harvard University research fellow. JAMA study, hormone therapy for menopausal symptoms safe at 50 to 59, raises risk after 70. A secondary analysis of two randomized clinical trials found that conjugated equine estrogens alone and CEE plus medroxyprogesterone acetate reduced vasomotor symptoms without raising the ASCVD risk in postmenopausal women aged 50 to 59. However, in women aged 70 and older with BMS, ASCVD risk increased. Findings support hormone therapy use in women 50 to 59, caution for ages 60 to 69, and avoidance in those above 70. Published in JAMA Internal Medicine, their investigation revised data from the landmark Women's Health Initiative hormone therapy trial. Jacques E. Rousseau, MD of the National Heart, Lung and Blood Institute and colleague examined outcome in 27,347 postmenopausal participants, aiming to clarify which women with moderate to severe VMS might safely benefit from hormone therapy. The analysis included women aged 50 to 79 years from 40 US clinical centers who were followed up for 8 years. Participants received either daily conjugated equine estrogen 0.625 mg alone, CEE combined with medroxyprogesterone acetate 2.5 mg or placebo. The primary focus was the incidence of atherosclerotic cardiovascular disease, which is the ASCVD, encompassing non-fatal heart attack, angina requiring hospitalization, coronary revascularization, ischemic stroke, peripheral arterial disease, carotid artery disease, or cardiovascular death. Gout tied to elevated 10-year risk of heart attack and stroke, study reveals. A large population-based study from South Korea has found that people with gout remain at a significantly higher risk of major cardiovascular events over a decade, even when long-term changes in blood pressure and cholesterol are taken into account. Researchers reported that worsening of these risk factors over 10 years further magnify the likelihood of stroke, heart attack, and death. Gout is a chronic inflammatory condition characterized by elevated uric acid levels and recurrent attacks of painful arthritis. While its connection to cardiovascular disease has been suspected for years, the study offers one of the most comprehensive assessment of how the disease interacts with evolving risk factors over time. The investigation, published in Rheumatology and led by Dr. Gonzu Gang of Division of Rheumatology at Jeju National University School of Medicine and Jeju National University Hospital, analyzed data from the Korean National Health Insurance Claim Database and the National Health Screening Program. It included 113,853 adults newly diagnosed with gout after January 2012 and more than 1.1 million age and sex-matched individuals without gout. All participants were followed for 10 years to track changes in cardiovascular risk factors and the occurrence of major adverse events. The results showed that gout independently predicted serious cardiovascular complications even after accounting for baseline risk factors and their changes over a decade. Patients with gout had a 50% higher chance of cerebral hemorrhage compared with controls. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.